Hey class, welcome to video 1, or A, going over the study guide of what you're going to need to know for the respiratory exam. And this is going to be broken up into 3 separate sections where I will now be going through the study guide and explaining what I think is important, providing the answers, showing it on the PowerPoint so that we're going to learn together and so that you can fill out your study guide. As a reminder, I would recommend that you would attempt to fill out the study guide on your own, looking at either the PowerPoint and then coming to here and going and workshopping it together. Or you could also pause the video as I'm going through the sections and seeing if you can answer it first, listen to me, and then do it. But let's cut to the chase. So part A is all about the anatomy overview of the respiratory system and piecing together why it exists and why it works. I have a recommendation here is I would break it up into sections and imagine that you're breathing in oxygen and breathing out carbon dioxide. And now we're going to look at all of the pieces that make that possible. So first here, we have the upper respiratory tract and the lower respiratory tract. Think about this, if you cut off your head, that divides your upper respiratory tract, and everything below your head is your lower respiratory tract. So if a question is asked looking at, is the larynx your upper or lower respiratory, it is technically going to be your upper. Now, an excellent page to review this is going to be on 51, which I will now just copy into the study guide. And this answers the question of the pathway of oxygen through and carbon dioxide out. So let's look at it. Nares, nose. Nasal cavity, nasopharynx, oropharynx, laryngopharynx, larynx, trachea. Now, up until the larynx, that's all upper respiratory system. These 3 sections right here are all the pharynx, which is essentially the back of your throat, and they divide it up into 3 sections. There's the naso, nose section, oro, mouth section, and laryngo, which is where you're going into the throat. Now, the trachea. Now, the trachea is where we get into the lower respiratory tract. It is going to be this thing right here, which is then going to branch off into the 2 different lungs. You have one here, right and left. Pretty easy. We'll get into a little bit of differences about them soon. But you can see here, we have trachea, primary bronchi. Remember, think about like bronchiosaurus, bronchus right here. Secondary bronchi, tertiary bronchi, multiple branches, bronchiolus, terminal bronchiolus, respiratory bronchiolus, alveolar ducts, alveolar sacs. This is the pathway of oxygen. And if we look at it through this photo, nose, nasal cavity, the pharynx, which is divided up into those 3 sections, the larynx, trachea, primary bronchi, secondary bronchi, tertiary bronchi, branch off into multiple paths, bronchioles, terminal bronchiolus, respiratory bronchiolus, alveolar ducts, alveolar sacs. Now, the respiratory system is divided also into 2 other sections. So you have your upper versus lower respiratory tract. Division, or I would say separation, occurs at the head. Larynx is last upper tract. Trachea starts lower, and lower ends at alveolar sac. And as I always say in everything, my spelling might be awful, but if you know what I'm saying, and if you understand the concepts, other people will be like, oh, okay, they're going to forgive you for spelling incorrectly. It's always better to spell correctly, but what can you do? Now, alveoli. This is the important organ not organ, but it's the important section in your respiratory system, in your lungs, because that is where gas exchange occurs. This is how the anatomy of the respiratory system is broken up even further. So you have your upper and your lower, and then you have your conducting versus respiratory sections. Now, conductor, think about a train conductor. You are moving the trains along. Nothing's happening, but you're there directing it. Or you are the conductor of an orchestra. You're not making the music, you're conducting the music. In those sections, gas exchange is not occurring. Only in the respiratory sections is gas exchange occurring. So, if we would draw a little line right here is the division between the respiratory and the conducting. So, for respiratory section is respiratory bronchioli and the alveoli. So all the air that you breathe in, all the oxygen, all the gas exchange happens at these two places. Everything else is just moving the air in, moving the air out. That's all it exists for. That is all the conducting section. Now, the lungs. The lungs are going to be divided up into lobes. This is when you go to the doctor, they pull out the stethoscope and they put it and they're like, all right, breathe in, breathe in, breathe in. And then they do it on your back, breathe in, breathe in, breathe in. They're listening to see if it sounds smooth, if it sounds clean, and is there any rickets or rattling sounds. But if you ever paid attention, you have 5 lobes. 3 of them are on the right side, 2 of them are on the left side. So the next time you go to the doctor, when they bring out that stethoscope, you'll notice that your right side has 3 separate spots that they're going to listen to. Your left side has 2. And this is because if you see right here, there is actually a cavity for your heart. So the lung actually, on your left side, has a little nice space for your heart to beat. Now, this is important to understand because if we went all the way back to the circulatory system, we had those pulmonary arteries going directly to the lungs to exchange the gas to turn deoxygenated blood into oxygenated blood. It makes sense that the lungs and the heart are so close together because they have to work in tandem. Next section, or next question is, what is the basic function of the diaphragm? Now, potentially you've heard about this before, but if you haven't, let me give you a real-life example to help understand. Hiccups are super annoying because you can't stop creating a sound of air being forced out of your lungs without your control. This happens when your diaphragm, it's going to be a muscle that essentially sits right under your lungs. And now think about, we're going to get into pressure and why it's super important, but your diaphragm is going to be the thing that allows air to come in and air to come out. And it's all based off of pressure gradients. So if we zoom in here, this is the muscles about inspiration and expiration, and it's divided between the diaphragm and the external intercostal muscle. If you see here, the diaphragm muscle is directly under the lungs. Intercostals are in your, essentially on the lining of your rib cage. Between breaths, both are here. Inspiration. The diaphragm and interstitial or intercostal muscles contract. What this happens means is that your diaphragm essentially pulls down, expanding your lungs, allowing them to be bigger. This increases the height and the diameter, and it essentially will increase in volume. In the next section, we're going to really hammer home gas exchange, and I want you to think about it now. Why would increasing its volume matter? Because if you have a larger volume, you're going to create a pressure gradient. pressure is going to be a key word involving gas exchange. It'll make sense, and I'll explain it, but right now, know that when you are breathing in, your lungs are expanding. The diaphragm is pulling down, pulling your lungs down, making them longer, increase in diameter and height. The volume is getting bigger. The intercostal muscles are going to cause the thorax to increase, which is why your chest grows big. You can probably feel it. They are going to remain contracted until your breath finishes. And then when you breathe out, think about a balloon. You're essentially squeezing it to get the air out. As we talked earlier, by squeezing it, you are going to be shrinking it. By shrinking, you are now increasing the pressure in it, and that forces the air out. You have the diaphragm pulling up because it's being relaxed. It's returning to that normal state, which makes your lungs smaller. You have the intercostal muscles contracting as well, so your chest is getting in, and it essentially is going to squeeze the air out of your lungs. And then you go back to normal. So, diaphragm and intercostal muscles. Most important one is the diaphragm. When you breathe, that muscle contracts. When you breathe in, it is going to pull the lungs down. And when you breathe out, it's going to relax and essentially squeeze the lungs. You create a pressure gradient, and that is how you inspire and expire. Hiccups happen because that muscle is spasming. You don't have conscious control of it, and it is just going to contract at random, squeezing even though you don't want it to squeeze. So now for filling out our study guide, I would say diaphragm contracts, which increases the volume in the lungs. By doing this, you create a pressure gradient where oxygen, air really, goes in. When you exhale, the diaphragm relaxes and causes lungs to shrink. Think about squeezing a balloon. So air rushes out of your body. Intercostal muscles do work similarly, and these are found in your rib cage. Long and short of it, breathe in, diaphragm contracts, increases lung volume, pressure gradient. Breathe out, diaphragm relaxes, decreases lung volume, pressure gradient. Now, I'm not telling you, is the pressure higher on the outside or higher on the inside? We are going to get to that when we talk about the physiology, but I want you to think about it now, take a guess, put a little pin in it, and see when you come back to it, were you right? Because remember, things don't move unless there is pressure. Would you look at this? We're talking about the sections of the respiratory system again, upper and lower, conducting versus respiratory. Fill this in. Don't look at your notes, try your best, and then check back. Always try to quiz yourself every little bit and try to think about not clever, but try to make questions like you're a professor. So if you can see here, when I talked about hiccups, it was a real life example of trying to explain something. For here, you are now going to try to work back without looking at your notes to test yourself mid-thing. Always be thinking how this information could be worded as a question, and then answer your question, and then make sure that your answer was right. By doing this, you're reinforcing your knowledge over and over and over, and thinking, hey, how could this be worded for me? Makes it a little bit interesting and keeps you on your toes. And with all of us now having decreased attention spans, think about it as little tiny challenges that you can do it on the way to be like, oh, yeah, even though I'm studying, I'm still testing myself. Now, Table 21.1, I would recommend studying it, filling in the information for full anatomy and histology and yada, yada, yada. So this is the sheet. It is Table 21, and if we are looking in PowerPoint, I would do Table 21, and that is on page 65. Now, when I say, oh yeah, just make it blank, fill it out, how would I do that? Well, what I would do is I would come up here, click this, boom, blank it out, print it, or don't, but have a clean version of it and a not clean version, and see if you can fill it in, because everything we talked about anatomy so far can be found in this table with these structures. Now, let's break it down into what you actually have to know. In terms of the functions, you can see here most of them is just conduit for air, warms, moistens, filters, sound resonance, detect odors. It's talking about the function of upper and lower conducting versus the respiratory zones. For the upper, 4 things you need to know. It moves air. You can detect odors. It warms and moistens the air. And it assists in protecting your respiratory system. Now, I gave an example of this during lecture, but I really like it. If you go outside and it is cold and you have to run, that air is painful. Why? Well, your body is trying to tell you that, hey, idiot, get warm. You are decreasing our body temperature, and I don't like that. So it hurts. But remember, the body isn't punishing you on purpose. It is trying to tell your brain in a way to make you stop doing something. So the respiratory system, and especially the nose, has a beautiful function. It warms the air, it moistens the air, and it filters the air. So, all those nose hairs that you hate and try to get rid of and everything, it serves a function. It is to try to catch dust particles, bacteria, pathogens, anything of that. Now, you have a lot of blood in your nose. I'm sure that people have had bloody noses or got hit, and you were probably surprised at the amount of blood that rushes out of your nose. A less savory example, but probably something that might resonate with people as like, oh, that's why. A lot of drugs are taken through your nose. This is because there is a ton of blood vessels and capillaries in your nose. So it's able to be absorbed incredibly quickly, as well as it goes into the lungs, it directly interacts with your bloodstream. So that's one of the reasons that a lot of drugs are taken inhalationally, because it's the fastest and most potent acting form of it, because of how much blood vessels there are and how thin those layers are to create gas exchange. You're getting stuff into the blood. Now, for the nose specifically, you're not doing gas exchange because it's not in the respiratory section. But blood is incredibly good at temperature regulation. Think about water as well. By breathing in air through your nose and having that much blood there, it's warming the air as it goes. The mucosal membranes helps to moisten it and capture things. That's what you need to know about the upper respiratory system in terms of some functions, as well as your voice box. Now, because this test is going to be GI and lungs, I'm not going to go super deep into some of the knowledge, but I want you to know that your voice box and where your sound comes from and why we all sound different is because of your larynx. You have essentially vocal folds and cords in your larynx that vibrate when you are moving air and sound through them. Also, if you notice, like I hate the sound of my voice whenever I listen to these recordings because it sounds different than how I think I sound. That's part of the bone structure and resonance of your sinuses and air pockets and just bones that it sounds different to you than it actually does coming out. Terrifying, right? Now, you can see that there's a ton of epithelial or other histological features. I'm perfectly fine with you not knowing the epithelia for the conducting respiratory system, but I do kind of want you to look at the respiratory epithelium. It's simple cuboidal to simple squamous. Extremely thin, simple squamous. When we go into the physiology, that's going to be important. It'll make sense when you get there, but that's the only epithelium that I want you to know. So when you study this table, or when I'm saying anatomically, study this table, what I'm really looking for you is for you to test yourself. Know the pathway. You breathe in and out. Know the upper and the lower. Know the conducting versus the respiratory. Know that in the upper respiratory system and everything, that it is going to filter the air, that is going to warm it, that is going to moisten it, that you have mucus, that you have things to catch bacteria. Know that your larynx is your vocal cords and where your voice box comes from. And in the respiratory, the gas exchange section, know that you have simple squamous epithelium. You're good. Now, if we go back to our chart, boom. Section A of the respiratory system done, filled out. I would like to add something to this. Now that I'm thinking about it, it's going to be covered in more detail in the physiology, but as the most important area of the lung, I just want you guys to get a good look at the alveolar sacs and the alveoli as well. Now, these little things that look like grapes are found at the end of your terminal bronchi and the respiratory bronchioles. This is where gas exchange is going to happen, and this is where all the magic is. This is going to directly interface with your capillaries, with your blood system, and you can see here you have your alveolus, you have your respiratory membrane, you have your erythrocyte, or red blood cell, and you have this incredibly thin respiratory membrane. I'll see you guys in the next one.